Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the Pennsylvania budget really does affect about 12 million of us who live in the state. Last week, we heard from the state's business community. Today, we're going to get into health care and education. But first, let's take a look at health care, and particularly, how does the Affordable Care Act, translation Obamacare, affect all of us in this state? We'll take that up after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, welcome back to the show. Joining me is Paula Bussard. She is with the Pennsylvania, help me out here, the Hospital and Health Systems Association, HAP. I should get that right after all these years of knowing you and working on stuff with you. All right. Paul, let's start with what's right with the Affordable Care Act.
Well, the Affordable Care Act helped 1.1 million uninsured Pennsylvanians secure health insurance coverage, either through the marketplace or Medicaid, or because they were able to stay on their parents' health insurance plan. Mm-hmm. And the other thing it did was help healthcare reform how we were delivering care by focusing on the patient across the continuum of care, making sure that we were focused on their health needs.
Right. We had a large number of uninsured folks in this state when the Affordable Care Act was passed way back in, 2010? 10? Yeah, in the spring of 2010, I think. The fact of the matter is that we had do you know about how many people are now covered in this state under the Affordable Care Act?
Well, it is 1.1 million. What it is about 700,000 who secured low-income working adults who secured health insurance under Medicaid, about 426,000 by being able to get health care through the marketplace, and then about 90,000 young adults who were able to stay on one of their parents' health plans.
Now, there's a Medicaid piece to that it's very complicated. And, you know, Governor Wolf when he's talked about Medicaid and the Health Care Act, has gone out of his way to raise questions about what would happen to hundreds of thousands of Pennsylvanians who have this relationship between the Affordable Care Act and Medicaid. What's that? How can you put that in words that we can all understand?
They are adults who are working. Their jobs pay less than about $16,000 a year, which is kind of hard to buy health insurance. I'd note that Pennsylvania, having a large rural population, about 3/4 of Pennsylvanians in rural Pennsylvania who got coverage under the Affordable Care Act, it was through Medicaid. So they're working, they're paying sales tax, taxes for Medicare, but they just don't have a job that either provides health insurance or they don't earn enough to buy it. And it is really important for them to be able to have access to primary and preventive care to be able to continue working.
Sure. Now let's talk about a piece of this that is, I think, pretty controversial, and that has to do with the increases. If you go out and you buy insurance, you pay a premium, and those premiums have gone up from the insurance companies. How does that get resolved when you have these premiums going up? I read in some states 42, 50%.
That is the challenge. Probably one of the biggest issues that really needs to be addressed in replacement is how to stabilize premiums. Because if the individual can't afford it, that's a problem. If taxpayers can't afford it, that's a problem as well. And we want individuals to have choice of plans, and we want it to be affordable. So I think that's an area where yesterday new rules on stabilizing the insurance market came out from the Centers for Medicare and Medicaid Services. That's probably one of the more difficult aspects that we have to work on.
We're going to run to a break. When we come back, I want to pursue this, and I want to give you a chance to say what else is right. I don't want to move beyond that. But then this is certainly a problem that does need to be addressed, and we can chat about that and more. I'm talking with Paula Bussard. She's with the Hospital and Health Systems Association of Pennsylvania, and we'll be back.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
We're talking about health care and the health systems that operate within Pennsylvania and nationally as well. We'll get into education, which was the #1 priority in electing Governor Wolf in 2014 with some folks who represent teachers throughout the state, Pennsylvania State Education Association. But first, I'm talking with Paula Bussard. She's with the Hospital and Healthsystem Association of PA, where she has spent a good bit of her time. This has been literally your life, hasn't it?
My adult life, yes.
Well, you know, a good way to put it, in the last couple of years, understanding and explaining the Affordable Care Act, otherwise known as Obamacare. But that's been one of the big criticisms of the law, no doubt, has been the rise in the premiums. The second one has been the number of providers who folks can buy insurance from. And apparently they are dropping out of the marketplace throughout the country, some states more than others. That's two pretty serious problems. But what can be done to stabilize the premiums if, in fact, we're losing insurance companies, which means competition if Paula wants to go out and buy coverage?
I think, insurance experts, and I think those are individuals one needs to talk to, is that it hasn't been in place long enough for the market to stabilize, because when you're dealing with individuals securing health coverage who hadn't had it, they want to be able to access a specialist or access a primary care. But when you look at states such as Massachusetts, who have had the broader coverage for a longer period of time, accessing the care, using the care stabilized. And so do we need a little bit more time? Do we need to have some of the parameters or requirements narrowed a bit so we can get to a more stable market of people accessing care, and then the cost of that premium going down?
It always seemed to me that what basically happens, if you want to insure people who hadn't been insured before, and a worthy goal, because if you don't do it now, folks are just going to wait longer and longer, and it's going to create more problems both
and
for them.
And be more expensive.
I was going to say, and for the health system, exactly. But the problem is when you do that, somebody has to pay for it. And it seems to me that's the heart of the matter, is that it shifts cost. And the question is there a better way to do that shifts cost in a way that's more equally distributed? I don't know. I don't have an answer. You're smiling. They've been debating that in Congress for 6 years now, without 7 years.
Well, and in actuality, since the inception of Medicare and Medicaid.
Well, that's true.
So for quite some time.
But they got pretty well accepted by the public, Medicare. In fact, you fool around with Medicare and Medicaid, you were politically in trouble. But go ahead, finish.
So, anyways, we've been in Pennsylvania. I mean, we're down below maybe about 7% uninsured, where we haven't been for decades. So in 2 years, getting to there is an incredible accomplishment. But we have to focus on, okay, what is next?
That's
now, on the
point.
hospital and doctors and nurses side, the provision of care, we've been working on bringing down readmissions, preventable readmissions. We've reduced healthcare-acquired infections. We're improving outcomes. So we're doing our part to make care better, to provide it in the right setting. Almost 46% of what hospitals do is on the outpatient side, a lower expensive.
What I sort of equate this to, and I'll get into this in the next segment. This may sound a little different. I sort of equate that to pre-K when you get to schools. If you get into pre-K and the kids get prepared, you know what I mean? They can go and be more successful when they get into kindergarten and move through the schools, and that we need to think smart about that.
We're focusing on primary and preventive care. We're focusing on better management of, or actually preventive of some of the chronic conditions, but better management of chronic care conditions. And so in a couple of years, because even though the Act was passed in 2010, the coverage expansion didn't start until 2014. 15.
Okay.
So we don't have enough experience to get to where, how can we stabilize the usage of healthcare?
Paula Bussard, the Chief Strategy Officer for HAP. What would your suggestion be for Congress to slow down? Go ahead. You answer it. I'm not going to.
Because simply repealing without replacing, first, in Pennsylvania, 1.1 million individuals would lose their health insurance coverage. Second, the Affordable Care Act, as you may remember, to be able to pay for the cost of the expanded care, cut payments to providers. If you repeal and don't replace, those cuts stay in place, it could be devastating for Pennsilians accessing good quality care.
Well, it's obviously become a problem because, they've not been able in Congress to do very much. It's now in a sense called repeal and modify, or repeal and
repair
and repair, or don't totally repeal. Just sort of take the parts of it that need fixed, if they can get agreement on it, and try to make it better. And there are a fair number of people who believe that's what ought to be done. And now it's not likely to get done for months. At least the word that comes out of Washington.
Well, we want that thoughtful, cautious approach. Make sure that it's being, the problem areas of the Act are being addressed, looking at the strength of the Act, because it really has fostered a lot of transformation.
All right, well, thanks for coming on and for the help in understanding a very complicated law and how it's been implemented. At any rate, we're going to deal with education. This affects, again, 12 million of us in one way or another, and we'll get to that after we pay a couple of bills.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
All right, as we mentioned a couple of times before, we're going to get all kinds of views on this show. This is what we believe in. Well, Jerry Oleksiak is here. He's the president of PSEA, and he gets mad at me if I don't say he was a special education teacher, right? You have every right if that's not.
Over 30 years in the classroom.
Over 30 years, yeah, great job. All right, Governor Wolf, once again, he was elected to a large extent because of his saying we have to do something about increasing support for basic education, special education. He went through the gamut. And once again, the budget that he has proposed for the next fiscal year, $100 million for basic ed, $25 million for special ed. And what is it, 75 for pre-K million?
75, I believe, for pre-K, and there's some money for higher ed as well.
For higher ed, yeah, not enough, according to the state colleges. They're almost 9. All right, so let's talk about the budget. Your organization, you represent the teachers and other school personnel in the classroom. Happy or unhappy about it?
Well, we're very happy with it. Clearly, we're just about. It took this third budget to get caught up to the cuts we suffered under the previous administration. So it would be nice to see more. The schools need more, but we are very happy with the fact that the governor has made it a priority when he ran, and has continued to make it a priority, and he's living up to that promise.
You know what's fascinating? There's deep divisions in the legislature on a lot of measures. Right. I don't see it on funding for the schools. Do you? I mean, I'm not saying there aren't some lawmakers who don't, but overall, would you say, you've been involved in this for a couple years, talking with lawmakers? It
has changed significantly in the past few years. People realized that we could not continue, on both sides of the aisle, realized that we could not continue the way we were. And there seems to be a growing consensus. It's a minority of folks in the legislature that think there's too much money now. So we're very happy to see that. And it's a shame that it took the reality of 27,000 educators losing their jobs and schools being hit the way they were.
And I point out, this doesn't mean that in schools and school districts they shouldn't be looking at ways to save money and cut expenses. And I mean, that doesn't let them off the hook for taking responsibility for themselves. But
not at all.
All right, I want to go to something else. School breakfast programs, why are they important? Governor wants to expand. Tell me why you think they're important.
You know, the old saying, it's the most important meal of the day. It really is. And we have too many of our students in Pennsylvania, the kids that come into the buildings, they're hungry. Right. They count on the not just the food that is provided at school, but medical care and the sorts of counseling services, social work services that so many families need. But the governor is committed. I know Mrs. Wolf is very involved in this program as well, to providing money from the state for breakfast programs. And with what the governor is going to do, it will free up some federal money as well that will come into the schools to provide the basic good start to the day and the nutrition.
And about half of the kids that need it don't get a breakfast. Is that right?
That's right. And there's a price paid for that. Unfortunately, it's. When kids are hungry, they just can't focus. And it's not, again, I've had students that come in with a toothache, or they've been sleeping in a car the night before. It really is a tough situation, but we can do something immediately about the breakfast program, and that's
I would think that wouldn't be very controversial, but we're going to run to a break. But there's something that is we hit on the things where we get a lot of agreement. Now we're going to talk about the minimum wage. We'll take a break and we'll come and do that.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine, and by the Pennsylvania Healthcare Association, advancing quality, improving lives.
All right, welcome back with Jerry Oleksiak. He's the president of Pennsylvania State Education Association. All right, we hit on the things that people agree on. I don't think you're going to get total agreement. That's an understatement. Governor Wolf wants to increase the minimum age from $7.25 to $12. Do I got that?
Yes, $12.
All right, index for inflation. Why is that a good thing?
Well, you mentioned index for inflation. The buying power of the minimum wage right now is less than it was in the 80s.
Right.
So it hasn't changed in Pennsylvania since 2009. There's so many myths around the minimum wage. It hurts businesses. It does not hurt business. The most recent experience in Seattle, where it was raised to $15 an hour, the economy has benefited from that raise. The myth that it's teenagers working part-time at a fast food place, that's not it at all. There's, I think, 3 out of 5 folks that get minimum wage are women. Many of those, about half of those women, have children. So this is not, spending money. This is families struggling to do the right thing, and they're doing what we want people to do. They're working. They're trying to do the best they can for their families, and to ask them to do it on $7.25 an hour is ridiculous.
So what's the prospects for it? This is, a conservative Republican.
Right.
I don't use conservative and liberal in any pejorative way. I'm just using it descriptively.
Right.
You have a pretty liberal governor and a conservative, okay. I don't know about that.
I don't know either. I think, we talked about the consensus around education funding that's a good thing. There is no consensus, as you mentioned, around minimum wage. I think there's some sense that we've got to do something with it. Some folks think 12 is too ambitious. I'd like to see it a little more ambitious because it does.
The $15 that a lot of people talk about.
Right, and that I think would be a great way to go. But I understand what the governor is doing, and we support him.
Now I got to get to another controversial issue, and that's called paycheck protection. If I understand this right, since the beginning of collective bargaining, the employer would deduct the membership dues to PSEA and other organizations, the AFT. I'll mention other unions as well. And now there are people who say that should end because part of that goes to the Political Action Committee, and then that you engage in politics.
Well,
so what's your...
Well, there's a lot of myths around
I
this
understand
as well. Paycheck protection is not in state code anywhere. It's not a guarantee.
Right. It's just a term used.
But I mean the dues deduction is not in state code. I'm sorry, dues deduction is not in law anywhere.
Right.
That has to be negotiated at the bargaining table.
So that's done at the table.
So that's done locally at the table, and in any bargaining process there's give and take. So that's something that, okay, we'll do that in exchange for something else. So it's not a gift that the government gives. We've offered to pay what it costs. They can't. Many places they can't compute the cost because it's so minimal. It's basically a keystroke.
So you would argue it's just like you just hit a thing,
pretty much. And what it really is, it's an attempt to crush the union, to stop the voice of working men and women, particularly educators.
We're almost out of time, but I have to get to the issue that never dies, that comes up over and over again, property tax reform. And let me put it this way. There are proposals to eliminate $11 billion, that's it, would cause big increase in income, big increase in sales taxes. You have a problem with that. What's your problem?
We do. Well, the problem is, where's the money going to come to fund the schools? Our members own property. They pay property taxes. I'd like to see some adjustments in property tax reform as a homeowner. But the primary, where that money goes is to fund the schools. And if we take that money away, we have to fund the schools some way. And so you'd have to raise other taxes to do it.
To put it another way, you have a stable source of revenue. If every time there's a downturn in the economy, the income and sales tax drops, and sometimes pretty sharply.
Right.
So that would put the schools into a precarious fiscal situation. Is that one of your problems?
That's part of the problem. Another problem is that there would still be property taxes in some districts who have debt that they have to pay down in construction. So it doesn't eliminate it. We're not the only group who's got some concerns with this. There are folks from the Chamber of Commerce to the School Boards Association, business officers. A lot of folks have trouble.
All right,
with it.
Thanks for coming in. As I said, we're going to get all points of view on this. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.